You're tender all through. You have a lot of muscle knots here.
Yeah. Still tender as you go up, but not as painful. For
So
the lower
it
part.
definitely backs off.
Wow, it's even way up there. Wow.
It's tender up there too. Yeah. What I need from you is to pretend that my left hand is a pillow and just drop your head into it. Good. And your right shoulder, I want you to relax that as best you can.
Oh yeah.
All right, same deal. I'm gonna get you to just relax the head and relax the left shoulder as much as you can.
Yeah.
Whew. Good morning, EJ.
Good morning,
Good
Adam.
to see you here. EJ, if you can't tell from the shirt there, is another trainer at Primal Athletics like Roberto, who we've had on the channel beforehand. But he's in today regarding a couple of previous injuries regarding his shoulder, as well as some of the fallout resulting it. So why don't we just let EJ kind of take us away about what he's been dealing with.
So back in August 2019, I'm a rugby player. So during a rugby game, I dislocated my shoulder, had a torn labrum, Bankart lesion, and so I dealt with that for a few months until we realized that pain wasn't going away, just with physio and basic stuff. So I got an MRI, and that showed all the damaged structures, and then after the MRI, I got a reparative surgery for that. So I did rehab for that injury for quite a while.
Probably several
year and a
months
half.
to a year, right?
Yeah.
Okay. Oh, even longer. All
Yeah.
right.
It was also COVID season, so
Yeah, that's going to make it hard
wasn't
to get
like me
into
jumping
places.
straight back into sport after
Yeah.
doing some rehab. It was kind of just like continue doing rehab essentially. So yeah, I dealt with that for about a year and a half, and then a year and a half later, I got more comfortable returning to sport. COVID was a little less serious, so we're back in person training at school. So yeah, rugby season started again. Played a few games, was feeling okay, and then we had
oh god, okay.
we had one game where I got hit really hard on the left side, and I kind of felt my shoulder sublux a little bit. At that point, I should have taken myself out.
Should have,
but I did not because I'm stubborn.
How old were you at the time then?
21.
21. Okay. Yeah.
All right. Believe it or not, I was even more stubborn as a kid.
Okay. Yeah. Well, most of us are.
Yeah.
All right.
So yeah,
judgment's not quite
felt
there.
a sublux, got back up, did a range of motion test. I was like, it's okay, it's still in there. The very next play, had my arm extended out like this. Hit my arm, got yanked back in the external rotation, and completely just popped out.
right again.
So that time, damaged all the same structures, also pinched my axillary nerve. So my whole arm from like top of here to the side down my shoulder, down to my forearm was pretty numb. That numbness persisted for several months. Even if the initial injury, that dislocation, my arm was like out of its socket for a good 2 hours before I managed to get to the hospital.
Okay.
The doctor put it back in. So yeah, that was in October 2021.
Okay. So about 2 years ago.
Yeah.
All right.
Yeah. And I got another surgery, pretty much the same surgery, same spot, same shoulder, in January 2022.
And that would have been a year and a bit ago.
Yes.
Okay. All right.
Yes.
So how... Sorry to hear that. It obviously sucks. We found that in younger athletes who dislocate their shoulders, they are more predisposed to having it happen again and again and again, so long as that younger athlete remains those contact sports. The rates of redislocation actually go down past the age of 40. Fun fact. But what have you... good to know for in your case, right? Yeah. Is that associated with decreased contact sports? I don't know. Possibly. But probably. Regardless, what have you done to get your shoulder to where it is at this point in time? Because I've known you for several months now, and I actually had no inclination that you even had shoulder issues. So you carry yourself well. The posture seems okay, at least from this admittedly biased angle that I'm looking at you at. But so what have you done to kind of rehab it?
So initially, obviously after the surgery, I was pretty immobile in a sling, couldn't really move around a lot. So it was a lot of just like passive range of motion exercises. As I started to get a little more comfortable with that, after about maybe 2 to 3 months, then I got out of the sling. Then I could start doing more active range of motion stuff, a little bit of strength building. So that process was like another, 3 months maybe, before I started to feel my range of motion back to roughly 90% where it was before. And then from there it was mostly just strength.
Okay.
So since then, I was adamant the first few months after I got into that strength phase, then kind of tapered off a little bit, if I'm being honest.
So you were adamant in what capacity?
Like actually doing
being
the
very,
exercises
very
and
strict
stuff
with
I was
it.
supposed to
Okay,
do
yeah,
pretty much every day.
Mm-hmm.
But that started to wean off because I think there was like a mental factor associated with it, just because I knew it was a bad injury and I probably could not play at the same level I was before, because I was very competitive.
Mm-hmm.
I wanted to go pretty far, or as far as I could.
Mm-hmm.
And I kind of knew, part of my head, that I probably couldn't compete at that level anymore. So that really sucked. So that kind of discouraged me to continue with a strict rehab plan then onwards. And that's kind of where we are now.
Okay.
So I feel like I've gotten most of my range and I'm comfortable doing regular daily physical activities. But I still definitely notice a difference in both strength and even in the end of the range of motion. It kind of feels a little tighter and I can't go comfortably as far as compared to my right.
Now, when you say you can't go comfortably as far as that, because you start to feel a little bit unconfident in the shoulder then, or feel like it's going to re-pop out, or...
In most positions, no. I think my most vulnerable position would be shoulder abducted and externally rotated, like this.
Okay.
So even here, like pushing out, it starts to feel really tight, a little uncomfortable.
Really tight. Okay.
Not a lot of pain. It doesn't feel like, it's going to pop out right now, unless someone.
Obviously, we're not going to
like
be doing that today.
Yeah.
So, okay.
Otherwise, it's mostly just tightness and a little bit of weakness.
Okay. So, tightness and weakness, shoulder issues. So, EJ's dislocated that shoulder twice now, which means that now we're going to have some degree of glenohumeral instability going forward. So, me, I'm a chiropractor. A lot of people are thinking, okay, he's going to adjust the shoulder. No, actually, that's contraindicated in cases of hypermobility as a result of dislocation. Okay, so instead what we're going to be doing is definitely looking to try to maintain the exercise protocol that he's done. He's done that completely correct. The shoulder itself, probably our most mobile joint in our body. Okay, the stability is largely a result of the muscles around it and the strength you can build up. There are some soft tissue things there that he mentioned, like the labrum, but they do not contribute to stability in the same way that our rotator cuff muscles do. So keeping up with the physio. Pain and discomfort wise, we can hit it with some massage, we can hit it with some acupuncture, which we will likely explore today, hopefully on camera if we have enough time. So that basically covers at least the shoulder component. Now, what else do you have going on? Because you just mentioned that you do have like right-sided neck discomfort. It's just probably from sleeping, oddly, or...
Yes. So, I just think I've been sleeping a little weird on the right side. The past couple of days I've noticed, like I wake up and I turn my head to... Which side, actually? Kind of like this, actually. Okay. This I feel the most stretch. Okay. And the right side of my trapezius going down. So it's just a little sore. I just think I just slept on it weird on my pillow. Not a huge regular problem that I have. It's just kind of something I've been feeling this week.
All right, so obviously we're still going to have our normal day-to-day things pop up, even if we do have an area of focal injury. So we can treat a neck complaint, no problem. One other thing worth mentioning is that anytime we do have a biomechanical issue of either the shoulder or the hip or any other joint structure, it's good form to examine both above and below that, as the shoulder, the neck, and the upper back all very interconnected biomechanically. If one is having an issue in moving to its full range of motion, in order to achieve that range of motion, you're going to get compensation in the areas above and below, either hypermobility or hypomobility, which can then contribute to other issues down the line. So for today, we can address the upper back, the middle back, and the shoulder for sure. Any kind of knee, hip, low back, or ankle complaints to mention?
Not as much. If we start going the bottom up, my ankles, I don't really feel any discomfort or pain or problems in general.
Good.
Only thing I would note is that I have very cracky ankles.
Okay.
So anytime I move my ankle, hear them crack.
Now, does that keep going over and over, or
pretty much?
You just keep going.
Pretty much.
Okay.
I think the main contributor to that is back in high school. I had a lot of ankle injuries.
Oh, so you did used to get a lot of them. Okay.
Yes. Yes. So I've definitely fractured. I don't even know which ankle, to be honest. It might have been both. I've definitely fractured at least one of them once. I've sprained both ankles several occasions.
Okay.
Yeah, I played a lot. I played mostly football. It was football.
You were very competitive, and your
Yes.
body's definitely taking the toll for it a little bit.
For sure.
Yeah.
And like I said, I was a very stubborn athlete, especially when I was in high school. So even if something was hurt or felt weird,
You're getting out there.
I'm still playing. The only time I wasn't playing is if I was emphasis is on seriously concussed.
DJ's a tough guy. Okay.
Yeah.
What do you want to do now? Are you trying to get into med school? Was it or?
Yeah.
Maybe he's that stubborn. He's gonna get in there. Hopefully, he didn't concuss himself too much.
It's fine. Let's maybe I won't share the number of concussions I have.
That can be off camera. That's what she does. Okay. Knee, hip, low back. Anything there?
Knees, again, nothing really serious.
Perfect.
I would say for my left knee in March 2016, rugby tournament.
Okay.
Rugby tournament, sevens. Really, I don't even know what part of someone's body. Maybe it was a knee-on-knee contact. Maybe
Sure.
my knee hit something hard.
Okay.
And from there, I had a little bit of contusion. I had a little bit of a bruise on my patellar.
And that was 2016.
Yes.
Any kind of fallout since? Because that was almost 7 years ago or 8 years ago.
So for the first month, I left it unaddressed. If I'm being honest, completely unaddressed because I thought,
as us men do,
because I didn't know really what the issue was. I thought the pain would go away, but it came because I could still walk and do pretty much everything normally without any pain or discomfort. But then you just like a light little tap on that spot. Intense searing pain for like 10 to 20 seconds, and then it would just go away.
And that's since resolved itself.
It's resolved itself. So after a month, I was like, since it's not going away,
resolved.
Then I went to see a chiropractor. He sorted me out, did his assessments, gave me some exercise to do at home, just to strengthen the joint and the muscles around that area, and that helped it.
Perfect.
So now, the only fallout I feel is like, I can feel like a slight little bump in that area, and it also feels slightly numb. Compared
a little bit numbed as compared to the other side.
Yeah, so I'd say like feeling and sensation is about like 85 to 90% compared to the other one.
And then as far as that bump goes, like, are you talking about actually that right there?
A little lower,
right there. And you compare that to the other side and it's absent.
Yeah.
Okay.
But I don't know if you can like manually feel it or if I can just feel.
It does actually feel like there's a little protuberance there, something very, very small. So it's possible that if you did get a bone bruise there, do you know what Wolf's Law is? Have you heard of this before?
I should. I know that sounds familiar.
Is your background kin?
Yes.
Yeah. So Wolf's Law is this idea of any time that stress is put through a bony structure, that bony structure is going to try to adapt to that stress by building up more of itself. And that's actually how we end up getting conditions such as degenerative joint disease, osteoarthritis, because we have those joints rub. Eventually, they build up additional bone tissue to try to compensate and in response to that pressure. So it's possible that if he really did bang his knee that badly, that he did develop a little bit of an osteophyte there, something very, very small. Not something to be overly concerned about, just something worth making a note of. So, and then hip, low back. Anything there? You don't have to have an injury. I'm just asking.
No, the thing is, I've had previous injuries pretty much everywhere, but not everything still bothers me.
Okay.
So I feel fine in my thighs going up to my hips. On my left side, I did have a partial tear in one of my hamstrings back in, I don't know, summer 2017 maybe.
Okay.
That's been sorted out.
Perfect.
Actually rather quickly. It was initially supposed to be a 6 to 8 week estimated recovery.
Okay.
But I had another rugby tour coming up within 2 weeks. So
you just grabbed some duct tape.
I saw a physio and I went to acupuncturist. That's the first and only time I've ever done acupuncture. So they just put a bunch of needles in my hamstrings and my glutes. Seemed to help a little bit.
Okay, good.
And I was still wrapped up, had a tensor all around my thigh and my hips.
Different kind of tape, yeah.
Yeah, basically.
So
I guess you're right. I did just tape up.
Okay.
But yeah, that's been resolved since. In my hips, definitely as a teenager, I had a lot of issues with having my hip flexors really tight. Nothing like tore or anything like that, but maybe I just didn't like stretch or warm up enough. I don't know.
You were a kid. Kids or students, if you're sitting a lot, you're going to develop tight hip flexors inevitably, right? I mean, especially in that psoas muscle, which again is off the lumbar spine, connects down to the groin region. That's pretty commonplace. All right, so I think that just about covers the whole body. We'll get into the physical exam. We're definitely going to be focusing on the neck, shoulder, and the upper back today. Any questions before we get into that?
Nope.
Perfect. It was your left shoulder that was dislocated twice. Yes. However, we are feeling some discomfort in the right trap just as a consequence of this morning, or has it been the past few days?
Past 2 days or so.
Past 2 days. Yeah. Okay. So let's do a neck range of motion. I'm gonna get you started by bringing your chin down to your chest for me. Any discomfort in the right side or on the left side or anything at all in the back of your neck doing that? No. Okay. Now what if I take my hand and I push it down further? How about now? Still okay?
Yeah, I can just feel it stretch.
Stretch where? The whole thing?
Whole thing, yeah.
Okay. Come back up. Look towards the ceiling for me. Good. Any discomfort there on either side?
Nope.
No. Okay. I'm gonna again pull you back further. How's that?
Good.
Good. Perfect.
I just feel the stretch in like my Adam's
Now,
apple.
now in the front region. Okay.
Yeah.
So I'll get you to rotate your head as far as you can to the right, please. Good. So EJ is able to get pretty far. He's a little shaky though there. Now is that just because this is difficult to rotate this far?
Yeah,
or?
I'm just like really pushing the end range.
Okay. Yeah. So he's maybe at about 70 degrees. All right. Now let's go to the left as far as you can. And here we're at just over 45, so maybe 50. So there is a little bit of a decrease on the left rotation as compared to the right. That could be because, you can relax there, could be because he is really tight in the upper trap here. That's going to limit how far he can get. If we're able to release this muscle as well as whatever underlying joint structures are affected, his rotational ability should increase in that direction. So face forward. Let's get you to tilt your right ear down to your right shoulder, please. How's that on this side?
You can feel the stretch, but no pain or discomfort.
Feel the stretch, but no pain or discomfort. I'm going to go ahead a little bit more. Still the same thing?
Same thing.
Perfect. Now left to left. And how's that on this side?
Just feel a stretch, maybe slight discomfort.
Slight discomfort.
Yep.
Okay, so again, that right side is definitely more acute than whatever fallout is in the left side as well to the shoulder. So good news. Shoulder doesn't appear to be affecting the neck too much on that side. So EJ was just saying that he seems to have always had tight upper traps. Most people carry their stress up in the traps, at least I've found, and that's like if you're a desk worker or if you study hard as a student, you can really round forward, which then tightens all these guys up, right? Contribute that. Again, stress is a great exacerbator. It'll take any mild issue, make it a more serious one. It's pretty common, not necessarily something to be too concerned about, but it does tell us that we should focus on these guys. Now, have they calmed down since beforehand, or are they all still pretty? Because this does feel quite ropey to me, but it could be your normal. I don't know.
Honestly, this has kind of felt like the norm, at least since I was like 16, 17.
Really?
Yeah.
All right. So the norm has been quite ropey for EJ, which is, I mean, you can deal with it, and clearly he has been, but he doesn't necessarily have to, if that makes sense. There are options available to him. All right, let's get into the shoulder exam. I'm going to get you to bring your arm up. Give me a thumbs up right there. Good. And you can just face forward there. Keep your arm there, okay? I'm going to push down. Is that okay?
Yep.
Good. Okay, now give me a thumbs down. All right? Keep it there. That's okay?
Yep.
Perfect. All right. Now, I know you said that it was that external rotation that was most hesitant to you. So here, I want you to bring your arm back as far as you feel comfortable. Okay. Now, how does it feel right now in the front? Tight, or does it feel like it's going to have that dislocating pop?
Just a little tight. It doesn't
tight,
feel like it's
in the front here?
Yeah, in the front going up to the side. Here.
Okay, front going up to the side. All right, so I want you to push against me as hard as you can there, okay? How is that in the shoulder? That's okay?
It's okay. I feel a little bit of discomfort, slight pain in the side of my shoulder
in
here.
The side of the shoulder,
going
the
into
back
the back
region.
yeah.
Okay? So that makes sense considering we're testing his internal rotation and we got the subscap in that region. So go ahead. I want you to push now. How's that? That okay?
Yeah, it's okay.
That's okay.
A little bit of pain, similar area, but also a little more in the front as well.
More in the front
but
there.
not as painful.
Okay, good. Put this hand behind your back for me if you can. Is that okay?
As high up as I can.
Yeah, and then now I want you to actually try to lift your hand off your back and try to touch this wall back here.
We're doing this, yeah.
Just like that. You've done this one before, right?
Yeah.
Lift off test. How is that for you right now?
Not painful, but it does
Definitely
feel
difficult.
very
It's
difficult.
You're not able to get your hand that far. Oh, there we
I
go.
can
There
push
we
it up
go.
further,
Okay,
yeah.
good stuff. Awesome. I have to move to the side because his hand was getting a little close to something that it shouldn't touch in here. So
I definitely feel like I used to be able to do that more comfortably and get higher as well on my back.
Okay. Well, let's compare that to the other side. I'm going to get you to give me a thumbs up.
Yep.
Keep it there. Feels strong.
Feels a lot stronger.
Thumbs down.
Yep.
Good. Bring it back. And fight for the fight. Awesome. And bring it back. Fight for the fight. Good. Hands behind back. And lift off. Try to touch the wall. Phenomenal. Okay, so yeah, this shoulder, all clear. Definitely more hesitant with this guy. We're definitely going to want to keep it the rehab, but also look to what we can do to calm down some of that tightness, because there is quite a bit in there, and I think that's just from working so hard on it, right? Anyways, let's get you face down now. Okay, my hands are coming on your back now, okay?
Okay.
So first thing that I've noticed, even after just the first 3 little palpates there, is that EJ's got quite a muscular back. Okay, like his paraspinal musculature is very prominent. That's yes, but also that's just the truth. So working our way up, like even that feels like a rope, but a muscular rope. There you go. There's my attempt at actually flattering you. It kind of fell on its face, but. How does that feel right there? Because that feels like a little bit of a knot to me. But
yeah, feels good. Feels like you're working the right spot.
You like that, eh?
Yeah.
Okay, good. So that is right. Actually, is that levator scap? That's very close to EJ's levator scap, which again, very common muscle that's affected in people who also have tight traps. Goes right up into the cervical spine. Let's feel the left side, or the right side, excuse me. Also on this side, but it doesn't feel as bad to me right now. But how does it feel for you?
Yeah, I agree. The right side feels much looser, not as tense.
But that you still do have that tenderness or tension up here. Yeah,
you
even when I
get
pinch
there,
there,
once
actually
you get
everything
there, yeah.
shrugs up on your side. So very much the traps that are affected on that right side. Okay. Oof. There too, eh?
Yeah.
Are you ticklish? Is that what that is?
That might have been a combination of both.
Okay, because yeah, you're calming down now. So as I mentioned earlier, anytime we have a shoulder issue, it's good form to look through the neck and the upper back due to any kind of biomechanical movement compensations. So we are quite tight in that left side of the thoracic spine, likely a consequence once again of the shoulder. So we're going to adjust up through here today. So EJ, I'm going to get you to take a big breath in for me.
All right.
And a big breath all the way out. Good. And again in. And all the way out. How are those?
Oh, that felt nice.
Good. Happy to
I
hear.
can feel and hear the cracks in there.
Oh yeah, they were quite. I think we got like basically all of them in through the T-spine there, so that's good. We're gonna try one more different adjustment right in this region here with the left scap, just to be complete. Take a big breath in for me, and I'm gonna turn your head as you exhale. Exhale. Oh, okay, nothing there. Oh, good. So once again, it was that left side shoulder. So the first region that I'm going to check right away is going to be the lower C-spine of VJ here. And that, how does that feel right there? Because I know how it feels for me.
Yeah, it feels a little slight pain.
Just a little slight pain on that left side. And remember, it is the right trap that he is sore on. So this is 2 separate sites, 2 separate complaints. But definitely the lower left C-spine, very likely as a result of the shoulder issue, but that's to be expected. We can definitely work through there. You're tender all through. You got a lot of muscle knots here.
Yeah. Still tender as you go up, but not as painful.
So it definitely backs off, eh?
Yeah.
Okay, good.
Wow, it's even way up there. Wow.
It's tender up there too. Yeah. It's not uncommon. If you have tight traps, remember that your traps are going to go all the way up to cover your occipital muscles at the top of your C-spine there, or base of your skull. Let's check out the right side, starting from the bottom. Oh, yeah. Okay.
Nice one.
Yeah, thanks. That's that was on the spot. Actually, I'm quite proud of myself. So not as tender on this side, but Or not as painful,
Not
rather?
as painful,
yeah,
no.
but...
A little bit in the very first spot in the bottom.
Again, at the base, right?
Yeah,
Largely
right at the
the
base.
traps. Okay.
Yeah, right there.
So
Right there.
Okay, yeah, that's all upper trap, so we can address that
Yeah.
later in the appointment. But let's absolutely do a little bit more soft tissue through the neck, and then we'll adjust in probably at the base for both sides with you. But we'll see what's available. Actually, even that at the top feels like it could go.
Yeah, a little bit.
Maybe the whole thing. Why not?
Not as much as the left, but
No.
yeah, right there. That's about yeah.
Okay. So let's find that right side once again. It was a little lower. Right there. Okay. All right. So what I need from you is to pretend that my left hand is a pillow and just drop your head into it. Good. And your right shoulder, I want you to relax that as best you can.
Oh yeah.
Well done. So that actually ended up being pretty much everything on your right side. Like I thought we were only going to get that 1 second, but we got basically everything almost right down to the base there too.
Yeah.
How does that feel?
Feels a bit better.
Feels better? Good. Awesome. Okay, so now we're going to pull the microphone over to the other side because we got to pick up the sound. That's why people click on YouTube videos for Pedro. So, okay, and let's check out the left side. So once again, the left side was mostly at the base. So okay. All right, same deal. I'm gonna get you to just relax the head and relax the left shoulder as much as you can.
Yeah.
Whew. Well done, EJ. You've only had that done once before, right? And that was by somebody who put a towel around your head, I assume, and did a yes?
Yeah.
Yeah? Okay, so.
On the side of a field.
Yes. Hopefully by somebody who knew what they were doing. Yeah. Maybe someday, but I'm not that desperate for views yet. Good stuff. Let's get this started. Now, with this as well, you could probably expect to get a little bit of redness. That might last for up to 72 hours, but it will dissipate, okay?
Sure. Okay.
Realize I probably should have told you this before I put the tools on you and before I put the camera on. And also, I forgot to drop the headpiece for you, so let's do that. There you go.
Right.
There you go, buddy. Yeah, are you okay with that? With
Yeah,
the
I'm okay.
potential redness? Perfect. So usually when I do this for people too, I ask them a question of sorts so that the people watching at home can kind of bond with you a little bit or get to know the patients a little bit better because you are real people and you have your real stories. So question I got for you then would be, tell us about something about yourself that you are proud of but don't get to talk about very often because it sounds like you would be bragging. So what comes to mind when I ask you that?
One thing that comes to mind is my rugby career, quote unquote, as I was growing up. So rugby has pretty much always been my favorite sport, and I've been very blessed with a lot of opportunities over the years. And at first, I started playing rugby when I was 10, and I pretty much just played, club level or school or whatever. It was just a sport. It was a fun little hobby thing to do on the side. When I was 16 years old, that's when a coach for Rugby Ontario saw me play, and from there he recruited me and wanted me to try out for Team Ontario Sevens for the under 18 team.
Wow.
And yeah, so I made the team and we went to BC and we competed, and that year actually we had 2 Ontario teams and both Ontario teams made it to the finals, so we brought home gold and silver. And then the subsequent year, same thing. We brought home gold. And after my first Ontario tour, a few months later actually, I started getting recruited for Youth Team Canada tours. Over the years, I've been blessed with the opportunities to get to play with Team Canada in several different countries around the world. And this is something that I have both been proud of and stressed over and beat myself up over. But I mention this because I do feel proud about the things I've been able to accomplish over the years. And I feel like I can't talk about this with everybody because, for example, if you look at some of the people I played rugby with in university for the varsity team, there were some guys where, like, you know, I'd be like stressed out over like an upcoming Canada tour or something like that, and I couldn't really have a serious, straightforward conversation with some people because our goals were different. I was at the stage where I'm trying to impress the Canada coaches, make it to the next level, play semi-professionally, professionally. Whereas those guys that I was trying to open up to, you know, they're at the stage where they're playing on the junior varsity team, they're just trying to make it to the varsity team, or they're just trying to make it to Team Ontario, which is stages I've kind of already passed at that point. And it was very hard to have those conversations because I'd be genuinely stressed out about my current situation and just looking for comfort or advice, but they might interpret it as bragging, which I really didn't like that much because I didn't really feel full of myself. I didn't feel like I was necessarily better than a lot of guys. I can name countless people I've played with that I think are much better than me and have had even better opportunities, or even should have had the opportunity that I got that they didn't. So yeah, that was honestly as proud and as great as it was to play for all those different teams. It was stressful at times, and it was difficult not being able to open up to some of my teammates about it because they were just in different places, I guess, had different goals.
Well, thank you for sharing. No, I mean, what you're saying applies to pretty much any situation when you're advancing, whether or not that's your career or your personal life or whatever it may be. Like, eventually you kind of outgrow your support network sometimes, right? And you need to look to find another one. So that's why it can definitely help to try to get closer potentially with the other members of Team Canada, even though I acknowledge they're probably all over Canada, right? Yeah. And then also like finding other mentors, such as whoever your new coaches would become, et cetera, et cetera. But that's thank you for sharing, because that's a life lesson that can be applied to pretty much any scenario. I know you, again, looking to become a doctor with the MCAT, you're eventually going to be needing to get close with other people who are in that situation rather than whatever your friends are doing right now, right? Because they're all past that stage of the education, I assume, and are trying to find jobs. Yeah. So, you know, if you go and say, oh, I'm going to be a doc, they might think that that's bragging. But, like, it's similar concept, different scenario, but you were able to get through it, is the good news. Sorry you had to go through that, and you probably felt a little bit alone, though.
A little bit. It's all right, though.
Doesn't kill us, makes us stronger, guy.
Yep. But that's all right, though. I know a lot of the guys, like, know I'm not trying to brag about anything. Mm-hmm. I've always been, or at least try to be humble with my athletic situations, because at the end of the day, like, I'm only confident in as far as my own ability goes. I never thought I could do more than I was capable of. Mm-hmm. So that kind of kept me grounded a little bit in terms of where I was and where I wanted to go versus realistically how far I thought I could go. And that was always my goal, just to go as far as I could, given the opportunities I was presented.
Well, I think you reached your goal then. And keep that mindset, again, for other things too.
Now, obviously, I do miss playing.
Of course.
But another thing I miss is getting to travel everywhere, man. Like, half the places I've ever been to in my life has been because of rugby.
Of course. I hadn't actually considered that. Like, if you're going with the team beforehand, it's all covered. But now, like, hey, you want to go somewhere? All right. How deep's your wallet? Right?
Not deep enough.
How much time off you got?
Like, you're telling me I can spend 8 days in New Zealand for like $800? Thank you. I'll take that.
That was when you were part of the sports team, right?
Yeah.
Jesus, that's... Can I come? I'll be the mascot.
Like, flights, accommodation, everything.
I ain't playing, but I'll be the mascot, no problem. Yeah.
But now it's just like trying to plan a trip. It was like, oh, can't afford it now. Maybe I'll save up for next year.
And then next year all the prices have gone up. Oh,
Yep.
Still can't afford it.
Still can't afford it.
Yeah.
Maybe we shouldn't leave the country. Let's just go somewhere close. I don't know.
Yeah. Good things, good things grow in Ontario isn't the right slogan here. What's it? Discover Ontario. The whole government's big thing to get people to travel
It is a
within the
big
province.
I guess.
Yeah, it is. If you've ever been up north, it is actually very nice there. But the problem is it's cold and I'm fragile. So,
Agreed.
Privileged Oakville boy here. If any of my roommates still watch this channel, they would laugh at that comment there. Privileged Oakville boy.
My first international rugby tour.
Mm-hmm.
That was actually just with my club, with Oakville Crusaders.
Okay. International though, so where'd you go?
We went to England and Wales.
Wow.
Back in 2015.
Like, obviously I expected, like, the States, but, like...
I mean, oh, sure, I've been around the States.
Yeah, but, like, then you're like, oh, England. You're like, what the hell?
Yeah. But with Team Canada, my first international... Ooh, yeah.
That's a thing right there.
Yeah. First tour... Oh, it's hard to focus now.
That's okay, yeah. So just a reminder, the trapezius muscle does go from top of the neck out to the shoulder and then comes down to insert back to the spine. So we're looking at the lower fibers here, and everything fires on when I press through there, eh?
Mm-hmm.
Yeah.
Oh, yeah. Mostly on my right side.
You're tough and you're strong, EJ. You're tough and you're strong, okay?
Thank you.
Studies show that positive reassurance for patients is beneficial across the board. So you're tough and you're strong.
Thank you.
You're welcome.
If you say it, must be true.
Exactly. Okay.
But yeah, my first tour for that was the Commonwealth Youth Games, which was hosted in the Bahamas.
The Bahamas!
Yep.
Oh! That's where I want all my tournaments to be. Not that I'm in any tournament. There's no Cairo tournaments that are going on, to the best of my knowledge.
There ought to be.
Yeah, there ought to. I'd definitely go in the runnings. I'd hope that all of my subscribers would watch me. Don't forget to like, comment, and subscribe. Okay.
This might be a bit obvious, but boy, it is hot there.
Is it?
Yeah.
Wouldn't have thunk.
Especially when you're playing sports, like
God.
rugby sevens. Oh my gosh.
Oh, you can't take a quick dip in the ocean between plays there? No?
No, not enough time, unfortunately.
Damn.
You should have to swim in your own sweat.
That's disgusting. All right. Let me get the extra oil off you there.
It's okay. Only 2 guys got heat stroke.
That's better than 3. It's got to be the worst rationale ever. It's better than 3, man.
It's true.
Yeah.
It's true.
When you're right, you're right, you know? Yeah. All right, now once again, EJ was saying that he feels the most stiffness in through the anterior aspect of the shoulder here, anterior meaning front, when he is maximally rotated like thus. This is external rotation. So we're also going to take some time to give the pec region a little bit of tender love and care, just to try to free it up a little bit. But again, the big emphasis here is more on stability than it is on mobility. We want him to maintain his resistance training, his strengthening, but we want him to be able to achieve that in as full a range of motion as possible. So it does make sense to try to restore that range of motion, but we don't want to push past anything that would be considered the normal. So how's that as far as end range goes? That's okay? That's comfortable? Yep. Perfect. Okay. This is actually kind of strange. I'm not used to scraping with my left hand.
Oh, wow.
Yeah. Thanks for challenging me.
Yeah, gotta be ambidextrous.
Yeah, exactly. That would be very beneficial to this job, but so far I've managed just fine being right-handed. So quite a bit of redness right there. That's tender, for you?
Yeah, it feels weird.
Yeah, so
I feel like I should have more muscle on that area. I
always
felt like my pecs were smaller than they should be.
Hey, that's subjective, okay?
Yeah,
I'm not going to be out here saying that you look small, okay? I'm not going to be out here saying that I could outbench you on any day of the week or anything. I wouldn't dream of saying that, EJ.
Mm-hmm.
Don't be insecure. It's a joke. It's a joke, buddy.
I know.
Oh, my God. Yeah, so obviously, like the people watching, you're not able to feel what I can feel in doing this, but one really cool thing about instrument-assisted soft tissue therapy, or gua sha, smart tools, Graston, whatever you want to call it, is that you can feel feedback, and I can feel almost as if I'm scraping over what feels like sandpaper to me through this thing. And that is actually the fascia, which I've talked about many times on this channel, or that saran wrap-like layer that encapsulates all of our muscles, all of our tissues, and usually provides a frictionless environment. So the fact that I'm going through it and it feels like sandpaper, well, that means that there's friction, there's adhesions present within the fascia. We release those adhesions, we decrease stiffness, we decrease pain, we increase range of motion. So this resulting redness is not a result of toxins being released from the body, which is a very common buzzword to kind of throw out there on a lot of other chiro channels. It's the result of releasing the adhesions within that fascia, which causes a very, 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 very small microbleed. Nothing to be concerned about, totally normal, unless, of course, you have severe kidney damage, which I didn't ask you about. Do you have severe kidney damage?
Not that I know of.
Phenomenal. If you had said yes, that would have been a really scary moment there. But guess what? He doesn't have severe kidney damage.
No, not yet.
Not yet. And, let's knock on wood, because I don't... Yeah, knock on that for us.
Is this wood?
Sure. Yeah, perfect.
Let's call
awesome.
It
good. Mm-hmm. Mm-hmm.
If I get kidney damage soon, I know who I'm calling.
Yes. This won't cause it, but it's just if you do get a little bit of breakdown of tissue, then it needs to be filtered through the kidneys.
We're like speaking it into the universe now.
Well, you know what? No, it's how can I undo this? You shouldn't do this if you have healthy kidneys. No, that doesn't work at all. No. Okay, so take that for a moment. Good. Okay, so I want you to lightly grip my tricep here.
No problem.
And then, save that for off camera, buddy. And then, no, it's okay. And then I'm just going to I want you to relax, be gentle with it, and I'm going to bring it down like that. Is that okay?
Yep.
Okay. Good. Oh, I got to make sure my head doesn't block this whole thing. So this is just a little bit of pec MRT in through here. Okay. Good. All right, and just relax. I'll get the extra off you. Good stuff. So bring your arm actually up for me for a second. Good. Just like that. Nice. And then you can drop it back down for me. Thank you. That's just to find a good landmark. always easier doing acupuncture on somebody who has more defined musculature. So thank you for having more defined musculature.
This is the only reason I've ever worked out, just to make your job easier.
Just to make my job easier?
Yeah.
Dude, thank you.
Mm.
Very selfless of you.
Yeah, that's what I do.
Think of others?
Yep. And just be jacked.
Of course. There it is. So one thing to be aware of if you're watching at home, not that you should be doing acupuncture yourself without the proper certification, is when we are needling anything that's remotely close to the upper back, is we need to be very wary of the two big air balloons that we have in our chest cavity, also known as lungs. You've definitely heard of these before. So every time we put a needle in, we need to make sure that we are either going into a bony landmark, such as the scap in the case of supraspinatus here. We got a scap right in the way. That'll make sure to protect the lung field. Or we're positioned at an oblique angle away from the lungs themselves. Okay, so basically, don't try this at home. If you are licensed in acupuncture, just a gentle reminder not to pop anybody's lung today.
That's a good rule.
As a good rule of thumb, I like to keep my patients out of the hospital, not send them in. Good. So. Okay, now actually I'll come from behind with the electrodes. Good. So. Another thing worth considering is EJ. Once again, he had 2 shoulder surgeries on this, so make sure there's no kind of metal implants if you're about to pass an electrical pulse through it. Yeah. 1, 2. Alright, now I'm going to turn the current on. You should first feel a gentle pulse, or a gentle pulsing sensation, and then you'll actually potentially feel the muscle itself fire on gently, okay?
Okay.
So
I'll tell you when I start to feel it.
Perfect. So first one's going to be these guys up top.
Okay. Alright, I'm starting to feel
there,
pulsing.
There we go.
Yep.
That's a pulse. Good. So there we go. How is that intense wise? Feels okay?
Yeah, it's okay.
Perfect. All right, now we're going to turn on the back ones. There we go. There's
It's
that.
starting to feel a little bit.
And there you go. I can see it. And now we're going to turn on the front ones. So I can't really see the front, so you let me know. Actually, I can by looking at the camera. Holy yeah.
Yeah, there you go.
The front there?
Front
Yeah,
just
very
sort of
much.
pulsing.
Okay, that's a little bit intense. I'll turn that down just a bit. A little bit more. There we go. Perfect. Okay, so how is that comfort-wise right now? That feels okay?
Yeah, it feels okay.
Perfect. Okay, so what we're going to do is we're going to camp out here for about 5 to 10 minutes.
Okay.
All right, and then we're ready to call it a day. Alright, think you're about good there, so we'll take you out. You might be a little bit sore after these guys, okay?
Nothing new.
Good, you're used to it. Okay, so let's take these off. Ooh, sorry there, buddy.
Scott, didn't feel anything.
Oh, perfect. You winced. I thought you did, but it's good.
Involuntary, I suppose.
Okay. Okay, and needles coming out. And you are needle free. You can move that shoulder around slowly to start, okay? EJ, How did that go for you? Yeah.
It went fantastic.
Good.
Yeah.
Happy to hear. Yeah. So what yeah, why don't you elaborate a little bit if you don't mind? Yeah.
So first of all, when you're doing the corrections in my neck and you felt all those cracks on either side, immediately after, like as soon as that happened, I just felt more relaxed and looser and everywhere. It wasn't as tense, as tight. Wasn't as much pain when you were doing your palpations afterwards. So I really enjoyed that.
Happy to hear
that. When you're doing the manual massage therapy on a rotator cuff and my shoulder, that felt good as well.
Happy.
It's been a while since I've had a massage like that.
Yeah.
Which I do miss. That is something I do miss about university. But yeah, I've always found a benefit to things like that, especially when you're working on my traps, just because, again, I'm a very tight individual. So there is a lot to work to be done that could be loosen me up. And yeah, felt very good.
Happy to hear. Very, very happy to hear. What do you think of the acupuncture, if anything? Yeah.
Acupuncture was good.
Good.
Yeah. I think better experience than my first time doing acupuncture.
Hey, good. That means at least I'm better than someone else there with the needles, right?
Yeah.
It's not that scary if you get stabbed correctly.
That's true.
Yeah.
Also, to be fair, the location was a bit different.
Oh, yeah. Okay, that would have been
My first time was my hamstring and in my butt. So
needles in the butt doesn't sound fun.
not really, because it's also a very big muscle, so there's a slight little contraction.
Everything's gonna clench.
It's a little easier to keep this.
That's
more
very much
loose
the
and relaxed.
truth. Yeah.
So I actually did like that, especially with the electrical currents. Personally, because I've had TENS done before, I've always liked the feeling of having electricity pulse through my muscles.
Yeah.
I don't know, it just feels cool.
Okay, well, I'm glad you think so.
Yeah, I feel pretty good. A lot better than I did an hour ago.
Good. Happy to hear. So EJ's got to make sure he keeps up with the strengthening of that shoulder, but again, important, we try to restore the full ROM and restore the full strength through that ROM. Did I say that correctly? Yeah, we want to increase range of motion, hopefully back to full, and then increase the muscular strength to increase stability. He's well on his way to being recovered. He's way better than what he was describing to me years ago, so overall he should be proud of the progress he's made.
Thank you.
Good. All right, do you have any last minute questions for me, or otherwise you think we're good to sign off for now?
Not really. I have to say, one of the best parts was when you told me to grab onto your tricep. And I'm glad I'm upset actually we only did that once. I feel like you could have worked that area a little bit more.
I'll see you next week.
All right.
Awesome. Take care, EJ.
Don't forget to like, comment, and subscribe.
Thank you so much, EJ.